I'm Dinesh Witharana. I'm a family physician, and I'm currently the medical director of Pilgrim's Hospice, a charitable organization that runs the Rusin Family Hospice Center. We have an amazing group of volunteers and staff who are extremely skilled and experienced. I'll sit down with the nurses, and they're really great at telling us how everyone's doing, as well as what they're concerned about. And I find the nurses' input so valuable, and so they get a really good sense of how people are doing and what their fears are and what's bothering them, and they can give us their kind of gestalt of this is what's going on right now. After I talk to the nurses and get a sense of kind of what the main issues are for the day, then I basically go room to room, chatting with people, seeing how their day is going, seeing what their plans are, checking in on them to make sure they're comfortable. It's also really helpful for me to see someone day to day, and if there are changes, I can pick up on little changes really easily as opposed to waiting 3 or 4 days and then big changes are happening and people are in a lot of distress. And so I find coming in every day is just really helpful for me to take really good care of them. After I've done seeing everyone, it's time to do the paperwork, the charting. So I sit down and tell the nurses kind of what I'm thinking is going on with each of the resident. It really helps give them an idea of what I'm worried about and what I'm expecting to see, so that they know also what to say to families and we can be on the same page and give the families the same messaging, and it really makes it feel like this is a team that's caring for them. After entering all the prescriptions and charting on what we talked about and completing all my documentation, I'm done for the day. Usually it's just coming home and just decompressing. And then that gives me a chance to think about what I saw that day. And some people kind of think like, oh, maybe I'm just thinking about all the sad things I saw. But I'm thinking about all the happy things that I saw. I'm thinking about seeing a sister talk to her sister and reminisce. I'm seeing a husband tell a wife how much her visits mean to him at the end of his life. I'm seeing a grandma talk to the grandkids and instilling her legacy. And I just get to see love. Every day I see love. At the end of the day, I'm a family physician, and my goal is to help a family, essentially. A lot of what I do is not just treating pain or shortness of breath, but alleviating the fear of the unknown. And that means sitting down with a family who's facing the scariest thing in their lives thus far and talking about here's what's gonna happen and here's how we're gonna deal with it so that your loved one is gonna be comfortable and live their life to the fullest. And a lot of family medicine is around sitting down with a family and talking about a scary new diagnosis and saying, I've got your back. I'm gonna follow you along this whole journey. Yeah, there's gonna be specialists and they'll come and they'll go and there'll be tests and there'll be medications, but no matter what happens, I'm gonna be there for you right to the end.